The official letter sent to the president calling on him to reform Medicare in the American Families Plan. Let's get into all of the details. Welcome, everybody. Hey, it's great to see you as always, and thank you so much for being part of this community. This community and this channel is what it is because of all of you. So hey, thank you so much for being here. If you happen to be new or if you haven't done so already, please make sure to hit the subscribe button right down below the video, and welcome to the channel. Thank you so much. I really appreciate it. So let's get into this. But just the other day, I made a video talking about this new letter that was submitted to the president calling on him to reform Medicare in the American Families Plan. With that being said, I told you that I would have my wife, Corey, come back and read the letter to you word for word, start to finish. So with that being said, I'm going to jump into it. I'm going to have Corey come in, read that letter to you, and I will catch you on the other side in just a couple minutes, and we can discuss some of the details. With that being said, take it away, Corey.
Dear President Biden and Vice President Harris, thank you for your leadership in prioritizing the well-being of families and older adults throughout the United States. We write to ask that the American Families Plan put forth a critical investment in healthcare to bolster the security of our country's economy and families. By prioritizing the inclusion of robust drug pricing provisions, we can produce enormous federal savings and use it to sustainably expand health coverage, equity, and access. As we emerge from the COVID-19 pandemic, the nation's most acute healthcare crisis in the last century, now more than ever, we must ensure that families and older adults are equipped with the health coverage they need. Medicare is one of the most popular and foundational federal programs in the United States. You have previously expressed commitments to expanding Medicare eligibility, improving its benefit package, and empowering Medicare to negotiate with pharmaceutical companies. As part of the American Family Plan, we respectfully request that you fulfill your commitment to expand and improve Medicare by including the following key provisions in the package. Expand Medicare by lowering the eligibility age. Improve Medicare benefits to include dental, vision, hearing, and out-of-pocket cap. And empower Medicare to negotiate drug prices for all Americans. Lowering the Medicare age would provide immediate coverage for millions of older adults who are still uninsured or underinsured. Researchers at Stanford University found that there is a sudden jump in the diagnosis of cancer among individuals who reach the age of 65 due to the fact that many older adults delay care for financial reasons until they have Medicare coverage. Their study also concluded that individuals ages 61 to 64 often lack insurance as a result of early retirement, pre-existing conditions hindering renewal, the high cost of private insurance, and other causes. Additionally, up to 25% of adults in this age group became uninsured or have experienced a gap in Medicare coverage prior to becoming eligible for Medicare. Lowering the Medicare eligibility age to 60 could enable an additional 23 million people to access Medicare coverage. Meanwhile, lowering the Medicare eligibility to 55 could expand Medicare coverage to over 40 million people. Expanding Medicare to these age groups is critical for addressing inequities in health coverage and access, as communities of color and low-income individuals are disproportionately more likely to be uninsured. There is also a critical need to improve the traditional Medicare benefit to include dental, vision, and hearing. According to the Commonwealth Fund, among Medicare beneficiaries, 75% of people who need a hearing aid did not have one. 70% of people who had trouble eating because of their teeth did not go to the dentist in the past year, and 43% of people who had trouble seeing did not have an eye exam in the past year. Poor oral health, vision loss, and hearing impairment have been independently linked to numerous negative health outcomes, such as diabetes, cardiovascular issues, depression, and dementia. Lastly, research shows that half of older adults who live alone don't have enough money to cover even their basic needs. Therefore, it's past time that we place an out-of-pocket spending cap to traditional Medicare, just as we have already for Medicare Advantage plans and other private insurance plans. Expanding and improving Medicare is not only good and critically needed policy, it also has support from overwhelming bipartisan majorities of the American people. According to a recent Gallup poll, 65% of Americans across party lines are in favor of lowering the Medicare eligibility age. Another poll found that 79% of polled older voters want a routine dental, vision, and hearing benefit added to Medicare. To pay for Medicare expansion, we believe Medicare and the federal government must finally be able to negotiate with pharmaceutical companies to lower the high price of prescription drugs. The United States spends, by far, more on prescription drugs than any other country, despite Medicare Part D being the largest purchaser in the world. The Congressional Budget Office estimated Medicare could save over $450 billion and increase revenue by $45 billion over the next decade by requiring Medicare to negotiate with pharmaceutical companies. Therefore, we request that the savings achieved by robust Medicare drug price negotiations be used to make critical expansions and improvements to Medicare, alongside other bold investments in health coverage and affordability. Medicare has the largest network of providers in the country and is one of the most affordable and accessible health insurance programs. Lowering the eligibility age and improving its benefits package would provide immediate and substantial relief for millions of individuals throughout the United States, as well as much-needed long-term security. Now is a historic opportunity to also make an important expansion of Medicare that will guarantee health care for millions of older adults and people with disabilities struggling with the health and economic realities of the COVID-19 pandemic. Therefore, we are asking for you to prioritize the expansion and improvement of Medicare in the American Families Plan. We strongly support this investment and stand ready to help your administration make it a reality.
All right, so there it is. As you can see in this letter, it's very clear-cut and straight to the point. They're basically asking the president to support the idea of lowering the eligibility age for Medicare down to 60 and expand benefits to include hearing, dental, and vision coverage. Now, this is nothing new, as we've seen Bernie Sanders kind of pounding the table on this thing for quite a while now. So it doesn't really come as a huge surprise that we have this letter going to the president basically calling on the same thing. You know, what's kind of funny about this, just to digress for a quick second here, I've said this many times before on throughout many of my videos. I've said the squeaky wheel is the one that gets the oil. Remember that? I've said it multiple times regarding stimulus checks. What is Bernie Sanders? Seriously, this is nothing against Bernie. I'm just saying, what is he? He's basically the squeaky wheel. He is always talking about this stuff. He gets tons of attention on this. Well, guess what? He's getting a little oil, you know what I mean? So it's basically what he's doing. He's getting a ton of attention about things that are important to him, just like Social Security reform, raising benefits, and stimulus checks are important to all of us, right? So we're trying to get as much attention, and we're trying to be the squeaky wheel on all of that stuff. So anyway, I thought that was kind of interesting because basically Bernie Sanders is doing the same thing about Medicare. He's been really hammering this thing home for a long time now. But anyway, that's basically what they're asking for. It's not too much to ask for, right? They're basically just saying, hey, let's let the federal government negotiate prescription drug prices, and, you know, that could bring in a lot of extra money or help us save a lot of money over many years. At the same time, we can then expand benefits to include hearing, dental, and vision. Well, what else is really interesting about this? I'm not sure if you caught this in the letter, but in that letter, they said something like, when people approach the age of 60, we start to see many more people starting to be diagnosed with cancer. Well, obviously, I'm not a doctor. I don't know stuff about this, but I just feel like this is interesting out of the letter that they're saying as many people hold off going to the doctor when they get to be around 60 because they're waiting to get Medicare coverage, and then they'll actually go because it's so expensive to go. Well, yeah, I mean, I could see that people would probably do that. If you were like a year or two out, you know, from getting Medicare, some people might think, hey, I'm just going to wait it out. I'm probably good to go. And then they neglect their health, which is really sad and unfortunate. And of course, this is not medical advice. I am not a doctor. Seriously, I don't even know how to spell doctor. I'm kidding. I do know how to spell that. I'm basically saying this is not medical advice at all. I'm just simply saying, yeah, I could possibly see a few people saying, I'm just going to kind of hold it out here. I'm so close to getting Medicare. Once I get that coverage, then I can go and, kind of get everything tuned up like a car, right? I'm going to go into the shop and get some new tires and get my oil changed and whatever. Anyway, I don't know anything about cars either. But anyway, so there's the letter. Anyway, in my video the other day, I said, hey, I'm going to bring Corey in and have her read the full letter to you. So there it is. So I hope this helps you out. I've added the letter over to my stack over here. I have a big pile of letters that I keep printing out that continue to be sent over to the president. So anyway, hope that helps you out. Thanks again, everybody. You're awesome. Like I said earlier, because of this community, the reason that this community exists is literally because of all of you. So, hey, thank you so much for being part of it. I truly appreciate it. You're just amazing people, and I just want to continue doing everything I can to help you out. I know it's a tough time right now. I know it's confusing. And I know that information continues to change like on an hourly basis. It's changing very rapidly. So I kind of boil everything down into these short videos and do whatever I can to help you through it. So thanks again. I really appreciate it. Make sure to subscribe if you haven't done so already, and check out any of my other videos right here on the channel, as I have over 1,100 videos. And also feel free to share them with your friends, family, and social media. Thanks again. I'll catch you later.